Hi, this is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond. And today in this video blog, we are talking about pre-eclampsia, which is more than pregnancy-induced hypertension. Now, a lot of people know a little bit about preeclampsia because back in the day, it was hypoxemia of pregnancy, meaning you had like a toxic condition of the blood, and it's the same thing, and we've just renamed it preeclampsia. But what a lot of people are unaware of is that it really is more than just high blood pressure of pregnancy. Preeclampsia can be a really serious medical condition and can advance to a medical emergency in which the mother and baby's lives are at risk. It can result in end organ damage, most notably kidney damage, and can cause grand mal seizures as well as strokes. So we're not talking about something that's just kind of a little nuance of pregnancy. I mean, it does include, it does occur during pregnancy, but it's not a little bitty thing. So let's talk a little bit about what preeclampsia is. And by definition, preeclampsia is defined as blood pressure greater than 140 over 90 milligrams mercury, a blood pressure 140 over 90 greater than on at least 2 occasions, 6 hours apart. But it also has to include protein in the urine, and that's greater than 300 milligrams in a 24-hour period. Now, a lot of people are like, well, how do you measure protein in the urine? I don't know about you, but when I was pregnant with my kids, every single time I went to the doctor, you had to pee in a little cup. And they started with doing the little dipstick in the urine. And that's the first indicator if they're starting to see protein in the urine. Then they will progress on to what we call a 24-hour urine, where you literally have to collect all your pee in a jug. And then they analyze it to see how much protein you put out over 24 hours. Now, it sounds kind of weird. It sounds kind of scary, like, oh, this could be really serious, and it can. But what I want to emphasize here is that early detection is important, incredibly important, which is why, and I mean, I know this probably doesn't pertain to many of you here watching this, your prenatal visits are crucial, that you go and that you regularly have your vital signs checked. And they always check blood pressure. I mean, that's probably one of the first things they do right after your weight, and pee in the cup. And these are the ways that we detect preeclampsia. Now, the interesting thing is, for a lot of women, they have absolutely no idea that this condition is going on within their bodies in the early stages. A lot of women are completely asymptomatic. They're going along, they're having a wonderful time, they're pregnant, they're happy, they feel good, and they go to a prenatal visit, and either there's protein in the urine or their blood pressure is starting to creep up a little bit, and then it's like, oh, something's wrong. My experience is that very rarely do we discover preeclampsia in a crisis. Usually there's been some indication. Now, I'll say that tongue-in-cheek in the situation where a woman has not been having routine prenatal visits. So she may present in a preeclamptic crisis, meaning, her blood pressure may be very elevated. She may have had a seizure. She may be in kidney shutdown, kidney failure. So, but most times women present and they have no immediate or noticeable signs or symptoms that they have this going on. The thing with preeclampsia, it can strike anyone. I mean, it can strike a first-time mom. It can strike a mom who's had 7 children. It can strike a mom who's in her 20s. It can strike on a mom who's, maybe having her last child in her 40s. One thing we do know is that women with pre-existing conditions such as high blood pressure when they're not pregnant, cardiovascular disease, diabetes, kidney disease, or blood clotting disorders are at increased risks of developing preeclampsia. We also see preeclampsia more often in women with multiple gestations. So if she's having twins or higher order gestation, mom is at increased risk because just the sheer load and the strain on the body is increasing blood pressure and putting her at risk. So there are a couple of things that people have asked about, like, well, is it more common in women who are overweight or obese? And currently, it's not a factor. We see it in very skinny women who have preeclampsia. But one thing we do know is that if a woman is overweight, it certainly doesn't help. So that is something that we do advise women to take care of, to, keep their weight in the quote unquote normal body weight range for their height, and especially kind of moderating how much weight they're gaining through pregnancy. There are a couple of things to know about preeclampsia, and it's classified as mild, moderate, or severe. Mild preeclampsia is mostly just the elevated blood pressure of 140/90 on 2 occasions, at least 6 hours apart. And you may start seeing a trace of protein in the urine, but we're nowhere near the end organ damage that can happen if preeclampsia is left untreated. The severe preeclampsia is the elevated blood pressure, definitely the protein in the urine, and then also having more symptoms, such as, and you have to have at least one of these to be considered severe. Neurological changes, meaning blurred vision, dizziness, severe headache, altered mental status, meaning you're not oriented to person, place, time. You could have had a stroke or a seizure. I mean, those are really, if you're to the point of stroke or seizure, you're really in the severe range. Liver damage, you might have some right upper quadrant abdominal pain, because that's where the liver is, but you'll see it in your blood work. You'll have elevated liver enzymes, and this is concerning because this is when you start seeing elevated liver enzymes, you start thinking of HELP syndrome, which is the very severe form of preeclampsia, where the damage done to the liver and the kidneys can be permanent. There can be permanent scarring or damage. With kidney failure or kidney strain, we'll have protein in the urine, decreased urine output, and often very dark urine because there may be some bleeding in through the kidneys. Pulmonary edema, which is fluid on the lungs, and many times women will have what we call intrauterine growth retardation because all of this is going on with the mom. The baby is not growing as would be expected. So, I mean, again, this is a critical emergency, not only for the mom, but also for her baby. And then as we talked about before, we'll see changes in mom's clotting. And so she may have increases in blood clot, but she may have thinning of platelets so that she has more bleeding. And, all of these things. One of these added symptoms, along with the high blood pressure and the protein in the urine, indicate that mom is on her way to severe preeclampsia and possibly a preeclamptic crisis and needs immediate treatment. So what are the treatments? Now there's been some talk about whether or not pregnant women should be taking a low dose aspirin, and I just went through and saw an article today, and they're saying low dose aspirin therapy, which we often prescribe for people with high blood pressure or heart disease, really doesn't have any bearing on preeclampsia. It doesn't really seem to help, so they're not recommending that right now. But what usually is or are the treatments are magnesium sulfate, which I've had a couple of friends have to take this, can kind of be grisly. It has a lot of its own little side effects, and a lot of the moms said it made them feel just as dizzy, if not worse, taking it. But it does help prevent the seizures, and it does help kind of with the blood pressure and the protein. The exact mechanism I don't quite understand, but I do know that it works. I've had friends who have had to take it, and it's just what works. For women who are more in the mild phase with just the elevated blood pressure and a little bit of protein in the urine, we can start them on antihypertensive medication. So some women are on nifedipine or some other calcium channel blockers. They typically don't do beta blockers, but wide range of antihypertensive medications and different ones that are good versus not good. So, and don't forget, if you're unsure and you have questions, you can check out that book, Prescription Medications During Pregnancy and Breastfeeding. It's an awesome resource, so I highly recommend that. And again, really just taking care of yourself. One of the reasons I wanted to address this, because I've had a couple of friends have preeclampsia during their pregnancy, and afterwards, we were talking, and they were like, "Well, what could I have done?" What they felt so powerless. And they're like, what could I have done? Even if there was one little thing that I could do while I was pregnant and dealing with this situation, what could I have done? Because they really wanted to feel like they were active in their own health care. And one of the things that I said to them is, you can do home blood pressure monitorings, because a lot of women with preeclampsia, yes, they're seeing their obstetrician more often, but it still may be just weekly or every 2 weeks or what have you. If you can have a little home blood pressure cuff, yes, I can speak. They have the nice little ones that go on the wrist, or you can get one that goes on the arm, whatever the type you get. Even if it's not completely in sync with your obstetrician's blood pressure cuff, and you can take it in and they'll kind of match them up for you, you will notice trends, and you can then call in and say, hey, over the last 3 days, my blood pressure has crept up, 5 points or whatever. So it's gone from 125 to 130. Is that something to be worried about? It may not be, but given, you have to consider your history or your multiple gestation and all these other things, your doctor may want to see that data. So that's something that you personally can do. Also, if you are prone to high blood pressure, or if you have been told you have preeclampsia and you're concerned, watch your salt intake. I mean, a lot of women, they get pregnant and it's like, woohoo, free, I'm eating for 2. Well, as much as they eat is eating for like 200. And really, when you're pregnant, you only need about 500 extra calories a day to adequately gestate your baby. And those should be really nutrient-dense calories, not a lot of junk food and chips and cookies and these types of things. And especially chips, which a lot of people like. I like them too. They add a lot of sodium, which can then increase your blood pressure and add to this whole preeclampsia thing. So, I tell women, you may feel like there's not a lot that you can do, but you can watch what you eat. You can make wise, healthy food choices. You can avoid salt. Now, there are some people say, well, salt doesn't have anything to do with preeclampsia, blah, blah, blah. But we do know that too much sodium intake is going to make you swell, and swelling around the face, hands, and feet is a hallmark of preeclampsia. So what are you going to do? Why would you want to take something or eat something that you know is going to exacerbate something that you're already trying to keep, from going crazy? So it just kind of makes sense. The other thing being is make sure that you're hydrated. A lot of women, especially mamas on bed rest, they're like, oh, I don't want to get up a lot. And so they're not drinking a lot. And when you're pregnant, you need a lot of fluid because you're building this baby and you've got amniotic fluid, you got the placenta. You need a lot of fluid. And what happens when women don't drink enough fluids, they tend to swell more because the body is holding on to every little drop of fluid it can get. If you can drink more, you can also prevent some of the swelling. It actually reduces blood pressure because things are more fluid, and it's just good for you and for your baby. So, I realize a lot of women may feel kind of like, oh, there's nothing I can do, but there is. You can watch your diet. You can watch your salt intake. You can take your blood pressure. Those are things that you can do. Now, I don't, when I say take your blood pressure, do not be obsessive and take it like every hour. But you can take it first thing in the morning when you wake up. You can take it, later in the day, early evening, and just kind of see where are your numbers falling rather, and put them down on a piece of paper. Tuesday night, 8 o'clock, this is my blood pressure. Tuesday morning, 8 o'clock, this is my blood pressure. It's really good information for your obstetrician. And, again, if you are having issues, you really want to be able to keep track. But watch your sodium intake and make sure you're really drinking a lot of water. When you're in bed, make sure you elevate your ankles so that that blood flow is going back towards the heart and not strained. And that also keeps your feet from swelling. Elevate the head of your bed with pillows so that, that helps with the facial swelling. These are little subtle things, but hopefully things that will make you feel better as well as be helpful in your care. You need to take an active role. So, it's just a little bit of something. So I just wanted to share this with you because, again, what did I have down here? About 11, what do they say? Overall hypertensive disorders account for about 11% of all pregnancy-related deaths, according to the Center for Disease control and prevention here in the U.S. 11%, that's a lot, related to high blood pressure issues. Again, preeclampsia is not simply pregnancy-induced hypertension, but it's a variant, and it's one that's actually more severe and can have very significant consequences. So you really want to be on top of it. If you suspect, if you have any questions, if you have any concerns, by all means get right in and speak with your obstetrician about it. Because again, preeclampsia is not simply pregnancy-induced hypertension. It can have deadly, deadly side effects if you're not adequately treated. So that's all I wanted to share with you today. Just a little rundown on preeclampsia, because I have to say we haven't seen a lot of that in our community here lately. We've been on the incompetent cervix thing, but it's really, really common, and it's a really major, I don't want to say primary, but it's really up there for why women are prescribed bed rest. So it's a huge factor for the whole bed rest community, and I just wanted to go over it right now. So if you have any questions, feel free to send them to me, info@mamasonbedrest.com. If you like this, put a comment. If you have a question, put a comment. Please share this with women who you know may be on bed rest, may be at risk of developing preeclampsia, or have questions about preeclampsia. We'd love to hear from them. Just share it in general, because we want you to share it. So thank you so much for listening. I hope this has been useful to you. I really hope you don't develop preeclampsia, but if you do, remember, watch your sodium intake, drink lots of water, and take your blood pressure about twice a day. Hopefully it all goes well for you. Thank you so much. This is Darline Turner, Bedrest Coach, owner.